Greetings, everyone. This is Terry Naturally. Of course, Terry Naturally. We're here every weekend. Same time, same station. All of the above. You can find us as you are here. Just come on back. And if you know somebody that would like to have better health, and they might want to know more about health and nutrition, because that's really the fuel of your body. That's how we become healthy. You put the right gas in your car, the right fuel. We are not putting the right fuel in our bodies to be healthy. It's not a lack of drugs. It's not a deficiency of drugs. It actually is a deficiency of the natural vitamins, minerals, and the other accessory food factors, polyphenols, all the above that make us healthy. And we are not choosing the right fuel for health and nutrition of our body. It's our responsibility, and I say this all the time. You might get sick and tired of it, but until you really understand, your doctor's not going to change your life. Drugs are not going to change your life. Now, I'm not saying you go off your drugs. There's a reason why the doctor put you on a drug or drugs. And if you want to be off of those, you can get off those drugs. As I've seen many people change their health by changing their diet, by changing the choices of the food they eat, and they have gone off their drugs. Now, I don't want you to do that on your own. Talk to your doctor first. Inform your doctor you are going to do everything you possibly can to get off your drugs. You don't need drugs. You need health and nutrition from the food you eat. And the American diet is a diet that is sorely missing 95% of all the nutrition. Just because you eat food doesn't mean you're providing the nutrients that your body requires to be healthy. That's it. We are not eating the food, natural food, whole food. We're eating man-made, manufactured food in a factory or a laboratory. And does not provide vitamins and minerals and nutrients. It's white flour, white sugar, coloring, preservatives, dyes, chemicals. That's not healthy. And you wonder why we're sick? We're sick because we are eating the food that food manufacturers make so that it's very cheap. Now, I know sometimes you might not be able to afford food of some kinds because they're expensive. Don't worry about it. You can find the best food possible that's healthy and nutritious, that's at a reasonable price. So what I like to do is share with you ideas on how you can change your health with supplements, natural alternatives, botanical extracts, and food. Food is your medicine. We have survived for millions of years on food. And only within the last 100 years has our diet changed so drastically that we are that desperately unhealthy. So today we're going to talk about why we have prostate cancer. Why do men have prostate cancer? And we're going to talk about the connection between sleep and pain, and how to stop glaucoma with B vitamins. And I'll caution you about that as well. We'll talk about curcumin for better blood sugar levels. And August is the beginning of allergies. And how do we increase muscle strength in just 4 minutes a day? Do you have 4 minutes a day to work on your muscle strength? It really tells a lot about who you are, how you can get around better, how you may want to travel. And actually, they tell us now that the muscle strength of our legs tell us how long we'll live. And the herb of the day, Rhodiola. Body fat is bad for your brain. Boy, that's a connection. A new study shows how to get rid of it. Get rid of the body fat. Improve your brain function. A lot of good things that we can do. Hey, our health is dependent on us to make the right choices. When you take your car into the gas station, you got to make the right choices. What gas do you put in your car? What fuel do you fuel your car with? What fuel do you use to fuel your body so it has energy, reduce fatigue, better sleep, better feelings, less irritability, just less toxic overall? So now we'll talk about prostate cancer. There are 2 types of prostate cancer. The first one, which is most cases of prostate cancer, are absolutely harmless. I had a good friend years ago. He came to my office. He said, I have to talk to you, Terry. So we went into the office. He said, please shut the door. He sat down. He said, I was just diagnosed with prostate cancer. He put his head down on the table and started crying. I said, come on. How do we know how bad it is? It could be very slow growing, which doesn't spread. Now my friend is still living. This is like 7 years ago. He's not crying anymore. He realizes that he had a very harmless case of prostate cancer. It's slow growing, doesn't metastasize, doesn't spread. And the 10-year survival rate is 98%. 10 years. Some prostate cancers are very, very aggressive and should be treated. The problem is, it is very hard to tell which type of prostate cancer each individual has, to tell the 2 types apart. With the tests that are currently available, it's difficult to determine which cancer is slow growing or growing aggressively. The most common screening test used is the PSA, which is the prostate specific antigen test. PSA. It doesn't tell you how bad your cancer is. It's a substance produced by the prostate gland. A high PSA level associated with increased risk of prostate cancer. PSA measures a risk, not whether or not you have cancer. It's just a risk factor. Low risk. A low risk is determined by the PSA being 4 or less. A high risk is a PSA of 10 or higher, which is up to 67% increased risk of cancer. Risk of cancer, not that you have cancer. In fact, the doctor that discovered this risk factor and the PSA score said he wished he never had discovered it, because it is not flawless. And it gives too many false indications whether or not you have cancer. So now the consequences of prostate cancer and the treatment. Aggressive therapy for prostate cancer, like surgery, radiation, chemotherapy, listen, can result in more harm than good. Don't be so fast to go under treatment. Talk to your doctor. Because 20% of men will have long-term urinary incontinence. 85% of men will have ED, erectile dysfunction, after prostate gland removal for cancer. Don't go under surgery so fast. Don't start taking drugs so fast. Work with your doctor. And natural ingredients can be very helpful. They reduce inflammation. They actually can bring down the PSA score to a lower level. You may have 10 when you first take the PSA score. Now, after treating it with natural ingredients, you're going to be down to a 1, 2, 3, or 4. Even below 0.5. Stop cancer cell replication and spreading without the adverse effects if you use something natural. Now, what's natural? What's good to treat prostate cancer? There are 5 ingredients that protect the prostate. Now, this is not for BPH, where you have to get up at night and go to the bathroom 2, 3, 4, 5 times. This is for lowering the PSA score. Curcumin stops cancer from spreading. Helps reduce the PSA levels in men with prostate cancer. Protected against the most common adverse effect experienced with radiotherapy is urinary problems. And that's in men being treated for prostate cancer. And pomegranate, shown to kill prostate cancer cells and slow the spreading of prostate cancer. Grapeseed, like curcumin. Grapeseed blocks inflammatory compounds associated with cancer spreading. This is managing the markers that may show you have an increased risk, but not necessarily that you have cancer. Aggressive prostate cancer has also been linked to a vitamin D, like dog, D, deficiency. A recent study found that men with low vitamin D levels were 4 to 5 times more likely to have aggressive prostate cancer than the men with normal vitamin D levels. Milk thistle. You might even find it out in your backyard. It's an American herb. And there's a special ingredient within the milk thistle called silibin, Silybin. Silibin from milk thistle. In cell studies with this compound, cancer cells exposed to silibin and other compounds from milk thistle was associated with up to 85% reduction in prostate cancer cell death. You have a lot on your side. Don't be so depressed and defeated if you've been diagnosed with prostate cancer. It may not be cancer. Just because you have a high risk level means just that. You have a high risk. Doesn't necessarily mean that it's cancer. And it could be possibly a slow growing cancer, well within the prostate cancer or prostate gland. Now, here are some dosages that I think are very important, that I always recommend. I tell them to talk to your doctor. If your doctor approves that you take natural products, we can work together. Vitamin D3, at least 1,500 IUs, and 750 milligrams of curcumin, the root or the rhizome of turmeric, which is enhanced with turmeric essential oils and highly standardized for curcuminoid complex. There are 3 curcuminoid complexes in curcumin. And prostate should also have pomegranate oil that is extracted by supercritical CO2 extraction process, and to obtain at least 60% of the compound of pomegranate. French grapeseed extract, standardized to contain 99% polyphenols and 80% OPCs. And then also the psilocybin phytosome. These are all ingredients that, when put together in a formulation, synergistically support one another and make the whole formula many, many, many times stronger than the individual ingredients. They work together. It's like putting a chain of links. You can make it very long. As long as the links are strong, the chain is strong. And these ingredients make the entire formulation very, very strong. So use these ingredients to improve your PSA levels. Lower them, which in essence is reducing the risk of prostate cancer. Now the connection between sleep and pain relief. Chronic pain can always equal poor sleep. How do you sleep when you're suffering from chronic pain? It's almost impossible. In fact, almost 90% of people with chronic pain also have very disastrous sleep problems, often because pain flares up at night and causes you to have pain. You toss and turn. You can't get comfortable. You don't know where to lie because of the pain. And researchers analyzed the data collected from 23 published studies on melatonin. Why melatonin? Because it reduces the pain and increases the sleep. And this study, which included over 2,000 subjects with all type of pain, including low back pain, arthritis, fibromyalgia, and the result, melatonin is just not to improve your sleep. Melatonin stops chronic pain as effectively as drugs, like acetaminophen, or otherwise Tylenol, while also improving sleep. I just love melatonin. So many people think it's just for sleep. It is the strongest anti-inflammatory natural molecule. It's also a very powerful antioxidant, pain reliever. Get to know melatonin better. And if you have pain, it's one of the best things to stop pain, especially at night. So I'm not sure if you know, but OTC sleep products, such as Tylenol PM, contain Benadryl, which can increase dementia risk. One such study found a 54% increased risk of dementia versus people who had never used Benadryl. Now, these are the risks you take if you decide to take drugs to see if you can't reduce the pain and get a better night's sleep. Every time you take a drug, you increase the risk of some kind of other side effect or adverse event. Is it worth it when natural products work as well as drugs? So now you can combine melatonin for pain-free sleep. I don't think many people know that. If I asked 10 people, what is melatonin for? Oh, for sleep. I have read so much research, and from the doctors and scientists and researchers that specialize in research on melatonin. They all claim to have a miracle on the hand. Melatonin is almost like a miracle. So here's the formulation that includes melatonin and is able to reduce pain. Curcumin and boswellia has been shown in multiple clinical studies to reduce pain, knee and joint pain, headache pain, neuropathy, and more. Now, vitamin B6 in its biologically active form, known as P5P, that's the active form, biologically active form of vitamin B6. When used in clinical studies, it has been shown to relieve nerve pain and used to treat carpal tunnel syndrome. DLPA boosts the endorphins in the brain, and they are called the body's own painkillers. And here's the dosage I recommend. 1,400 milligrams of DLPA. Boswellia, the resin extract, standardized to 70% total organic and boswellia acids. AKBA, 10%. Curcumin, extracted from the rhizome of the plant. And then combined with turmeric essential oils to increase the absorption by 700%. And then 60 milligrams of P5P. That's the biologically active form of vitamin B6. 5 milligrams of melatonin. The best time to take this formulation is around sunset. When the sun goes down and it's time to turn the lights on, that's the time to take your melatonin. Because melatonin is released from the pineal gland in the brain at sunset, when it becomes dark over the earth. So that's the best time to improve the health of your body, to get a good night's sleep, pain-free. Pain-free. Now let's talk about glaucoma. There's research that shows that the B vitamins are extremely important in stopping glaucoma. And with that, my friends, the clock tells me I need to take a break. The station to identify itself, play some commercials, and then I'll be back. And this is Terry Naturally with Terry Talks Nutrition. There's more to learn on glaucoma, how to stop it, with B vitamins and more. So don't go away. I'm not going anywhere. I'll be back in just a few seconds. So stay where you are, and then we'll be back here to the top of the hour. So hang on. This is Terry Naturally. And welcome back, my friends. This is Terry Naturally with Terry Talks Nutrition. We're here every weekend. We spend an hour together. Not nearly enough time to share with you all the ideas and concepts and research and science on natural nutrition and diet. Not dieting. Diet is the amount of food you eat and the type of food you eat. Make it the best you possibly can. And you will be healthy. Food is your best medicine. Don't ever shrink that, because that's the best way to live. So now we're going to talk about glaucoma. What is it? Well, it's a disease that damages the vision. It occurs when a buildup of fluid in the eye increases pressure inside the eye, damaging the optic nerve. If not treated, glaucoma can lead to significant loss of vision and even to the fact of causing blindness. There is no cure for glaucoma. It can be slowed, the risk can be reduced, but the damage to vision it causes cannot be reversed. Be very careful. This is a very serious condition that I would highly recommend that you see an eye physician, an eye doctor, because if you don't reduce the damage, you could go blind. And sometimes the natural alternatives don't work as well. So I don't want you to think that, oh, if I take a natural supplement, my glaucoma is going to go away. No. Be very, very careful. But there is some research. I'm just sharing with you for information. But talk to your doctor. And this is from a previous study using an animal model of glaucoma. The researchers found that aggressive forms of this disease could only be slowed by treatment with B vitamins, B6, B12, folate, while in milder cases, disease progression could be completely stopped. Now that's possible, but if you let it go too long, you could go blind. I don't want that to happen to you. Talk to your doctor as quickly as possible. You got to relieve that pressure. In new research, supplementation with vitamin B3, that's niacin or niacinamide, versus no supplementation, was compared in over 2,000 people with high eye pressure that hadn't yet reached the level of glaucoma diagnosis over a 3.7-year period. And overall, the niacin or the niacinamide group was less likely to progress to full glaucoma damage and less likely to need intensive treatment versus the group not taking niacin or niacinamide. That's vitamin B3. Now, twice as many people who did get more niacinamide required laser treatment for glaucoma symptoms. Almost twice as many people from the no extra niacinamide eventually needed medicated drops to reduce the eye pressure versus the extra niacinamide group. So look for a good quality daily multivitamin and mineral supplement that provides plenty of vitamin B3 from niacinamide. A really high quality multivitamin and mineral supplement. 1 or 2 tablets or capsules daily. But see your doctor. Don't mess around with glaucoma. I know several people who have gone blind. They waited too long. You will get pressure, pain in your head. And you'll think, oh, it'll go away. I got a severe headache. You don't know if it's going to go away. You better have it checked out. Don't let yourself get in a bad position where you might lose your vision. Curcumin is used for almost everything and anything. Curcumin can treat 20 different health conditions. And now let's talk about why it can help lower your blood sugar level. It's kind of like, is there anything curcumin can't do? And I've seen researchers, in fact, there's been over 30,000 studies done in the last few years, summarizing the results of how curcumin can treat 20 separate studies and conditions that tested the effects of curcumin in over 1,400 people with type 2 diabetes. They found that taking curcumin led to small but meaningful weight loss and reduction in belly size fat. If you have belly fat, that's the most damaging fat in the body. And other research has shown that curcumin lowers blood sugar levels and improves insulin sensitivity, as well as preventing the progression of prediabetes to full-on type 2 diabetes. Curcumin, I can't even begin to tell you how many conditions curcumin can reduce the side effects, reduce the adverse events, and improve the condition. It's amazing. And curcumin can play an important role in keeping blood sugar levels normal, along with diet and exercise. It's a great combination. Now, how can we increase muscle strength? In just 4 minutes per day? Truly? Really? 4 minutes. It only takes 4 minutes of exercise to prevent a fall. The elderly frequently fall. And after a disastrous fall, 25 to 30% of those who have fallen will not live the year out. So what can you do in just 4 minutes? Watch some cat videos on social media? Listen to a pop song? Get stronger with exercise. Just 4 minutes. Researchers developed a 4-minute workout. This is a 4-minute workout routine for 100 lazy, sedentary, lazy-like, with the average age of 74. The routine lasted 4 minutes total. 30 seconds each of the following exercise circuit. Do as many push-ups as you can. 3, 4, 5, whatever, 20, whatever you can do. Chair stands. So you sit down in a chair, go from sitting in the chair to standing, and do this as many times as you possibly can in 30 seconds. And the 2-arm resistant band rows. Stair stepping, using an adjustable step platform. After 12 weeks, the subjects significantly improved mobility, balance, and leg strength. All of these are important in preventing a fall. Your leg muscles are the most important muscles to strengthen. All of these will prevent a fall. 95% of broken hips in older adults are due to a fall. So get stronger. You can go on Google and look for a variety of ways to get stronger using only 5 or 10 very, very limited exercises. Wall squats or chair squats. Squat down on a chair, stand up, stand down, stand up, sit down, stand up. Do as many as you possibly can within 30 seconds. There's all kinds of ways that only takes a few minutes a day, that will prevent you from falling again. Oh boy, I love the next subject I want to talk about. Rhodiola. Rhodiola is one of my favorite herbs. Why? You'll learn why. For energy and resilience. Rhodiola grows naturally in cold, mountainous regions. It has been used in traditional medicine for energy and strength in Siberia, Russia, Tibet for over 2,000 years. In modern times, it was extensively researched by Russian Soviets for its ability to boost stamina, energy, and even used by their athletes and cosmonauts. Clinical studies have shown that rhodiola reduced fatigue by 30%, increased mental performance and concentration, relieves the symptoms of anxiety and depression, shown to help regular menstrual cycles and may help increase fertility. So how do you use rhodiola? Well, one way I use it in a formulation with rhodiola. And by the way, rhodiola is spelled R-H-O-D-I-O-L-A, rhodiola. But combine it with ashwagandha and take daily for energy levels, reduce fatigue, immune support, mental clarity. You don't need drugs or caffeine. Rhodiola is my favorite. Or use when needed during times of increased stress or illness. I think it's better used on an empty stomach, if possible. Here's the dosage I like. 500 to 1,500 milligrams with ashwagandha and about 60 milligrams of ashwagandha. But totally 500 to 1,500 milligrams together. So just make sure rhodiola and ashwagandha are used together. They support one another rather than individually. Rhodiola has been used for thousands of years. It works fantastically. Now, how does your body fat? Why is your body fat bad for your brain? Doesn't seem possible, right? Well, a new study shows how to get rid of your body fat and clear your brain. In fact, body fat ages your brain. Researchers collected data from over 9,000 adults, measuring the visceral fat, that's the fat in the belly fat, and assessing mental function. And the results, high amounts of visceral fat, that's the fat in your belly, commonly called the beer belly, or the bread belly, or the wheat belly. And that's associated with reduced mental function scores. Those with the highest amount of visceral fat effectively had brains 3 years older than people with the lowest amounts of visceral fat. Stay lean and trimmed. Every point increase in visceral fat effectively ages your brain another year. Why? Well, visceral fat is highly inflammatory. All that fat in your belly. You take drugs to reduce your inflammation because you have pain. But you might be grossly overweight. All those fat cells are spewing out inflammation. You're highly inflamed when you're fat. And the inflammation damages the brain and the rest of the body as well. Now, what is the best way for shedding the belly fat? How do you get rid of that belly fat? I have people write to me all the time, I have belly fat. What diet do I follow? What supplement do I take? Well, listen up. 91 overweight men and women were randomly assigned to one or four groups. They used what is called HIIT. It's a high volume exercise. And then they followed a low carb, high fat diet. Yes, fat diet. I don't care if you're overweight. I don't care if you're fat. If you eat enough fat, you'll lose weight. You got to get rid of the carbs to reduce weight. Get rid of the bread, the pasta, cakes, pies, all the bread stuff, all the flour stuff. Get rid of all that. And then both the combination of exercise and diet or control, no change to diet or exercise. And the results after 12 weeks with the high intensity exercise alone improved fitness, but did not significantly decrease belly fat. However, the diet plus exercise group had up to 23% reduction in belly fat. Results were better for reducing body fat than following a low-fat diet. Multiple studies that researchers report that the keto diet alone can lead to 10 to 20% of visceral fat. Follow the keto diet, KETO, ketogenic diet, along with exercise. You will feel so fantastic in a few months. You'll wonder why you didn't try this before. This is the way to do it. So, August is just around the corner. So August means allergies. August is the start of ragweed pollen season. Ragweed, a member of the sunflower family, which produces pollen from August to November. with pollen production peaking in September. One ragweed plant can release 1 billion pollen particles. 1 billion. Most people live in a sea of pollen, which have been found in the air as far as 400 miles out to sea. Ragweed is found in every state except Alaska. Up to 30% of Americans have an allergic reaction to ragweed pollen. Getting ragweed allergies under control can be done. Absolutely. It's all about histamine. And histamine is an immune compound that acts like an alarm bell, like your red light on the dashboard of your car. When something's wrong, the red light comes on. And histamine is released as a warning. However, it can react to things that are not dangerous, but when histamine is released, it causes itching, sneezing, a runny nose, watery eyes. We call this an allergic reaction. When histamine calms down, allergy symptoms subside. Quercetin, 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 reduces histamine by up to 97%. It has a broader range of activity than common allergy drugs without causing dryness or sleepiness. No side effects. Absolutely without side effects. And then Pleuron, Pleuran, from oyster mushrooms, helps train the immune system to not release unneeded histamine in the first place. It calms allergic reactions and helps prevent respiratory infection. Proven safe and effective even for kids. How to take these? Well, here are the recommendations I suggest. Take quercetin with vitamin C. Probably in most cases, vitamin C is already added to quercetin in the capsule. And also gamma-cyclodextrin to improve the absorption of quercetin and vitamin C. And also Pleuron combined with vitamin C. 100 milligrams of vitamin C. 100 milligrams of Pleuron, isolated from oyster mushrooms. Pleuron works in the intestines, so you should take it away from food. There are receptor sites in the intestinal tract for Pleuron to attach to do the job that it was meant to do. So take it on an empty stomach, ideally in the morning before breakfast, maybe 30 minutes before breakfast. Take Pleuron. Quercetin you can take anytime. The combination of these two should get you through the allergy season without any interruption. You'll feel fantastic. You'll feel wonderful. This is a great combination. Pleuron and quercetin. Those two herbal compounds work in the intestines. So take them together on an empty stomach before breakfast. 100 milligrams or even up to 300 milligrams of Pleuron. 250 milligrams of quercetin. Works extremely well. And that, my friends, I'm all out of time. This time goes by so fast. But you can always go to my website, TerryTalksNutrition.com. There you can read my newsletters, listen to past radio shows. They're archived there for your enjoyment, for your education, for your knowledge. You can also subscribe to my newsletter. I'll send it out to you every Friday to your email address. And those that we have already sent out, we archive them in the e-newsletter section for you to read for as long as you like. And if you have a special subject, put it in the search section, and 2 or 3 or 4 newsletters will pop up with more knowledge on that subject. Also for the radio show, you can listen to past radio shows. Excuse me. You can listen to past radio shows and all the radio shows you may have missed, or only maybe a section of it. You can listen to more. So with that, my friends, say a prayer for this crazy, crazy world. God bless you. You're on my prayer list. And God bless this great country.
Thank you for listening to Terry Talks Nutrition Weekly Show. Don't forget to subscribe and leave a review on your favorite podcast platform, including Apple, Google, and iHeartRadio.